Hey, hi Niharika.
Hi Nisha, how are you?
I'm good. How are you doing?
All good, all good.
So all set. My voice is clear.
Yeah,
Okay,
all good.
your voice is clear. So we'll just wait for a minute. Let our mothers
Yes,
join. I can see a lot of them joining in, and then we'll start. Hi
great.
Jyoti. Hi Umi, Pushpa. Hello to everyone. Just one more minute, and then we'll start our show for today. Hey everyone, please give us a thumbs up if our voice and the video everything is clear.
Hi Rachna, hi Archie.
Ah, I can see a lot of them following you have come online today.
This is my first live session. I usually don't do those.
Oh, yeah, I can see a lot of mummies just saying hi. It's a pretty common crowd. Very good, very good. Okay, so welcome mommies for yet another expert series. She is youngest chairperson of Foxy Young Talent Promotion Committee 2022. She really believes in empowering and uplifting women and is also associated with NGO Smriti towards the same cause. She is also an avid speaker at various national conferences, co-author of many books for the Obgyn. So you all can keep guessing. Let me introduce this personality step by step. Without taking much of your time, let's start with our interesting topic for today, the fertility boom. Estimates suggest that between 48 million couples and 186 million individuals lived with infertility globally. As we all know, infertility is a very common problem faced by both men and women globally. Isn't that a very huge number? But we all simply keep ignoring this topic. We don't want to accept it, we don't want to talk about it. We just think that infertility is a taboo and it can't be cured. And we just start living with it. Trust me, both the statements are wrong. So today, Nutrizoe has taken a step with Dr. Niharika to be a guiding light for lot many couples out there who are facing both fertility and infertility issues. Um, Today we have Dr. Niharika, infertility specialist all the way from Agra. A very warm welcome, Niharika. So good to have you today here with such a sensitive topic or such a sensitive issue to discuss for.
Thank you so much, and thank you for having me here. You really pushed me into this.
I have to because the topic is really dear to us also and
Yes,
to you also. And it
that's so.
really required someone with experience and someone who's from that forum to come and talk about it.
Yeah. So yeah, we were talking about infertility, and you know that it's been really rising.
Right.
Most of my friends keep telling me that I want to conceive, and somehow they still don't go to a infertility specialist. Even if I tell them come and show me, they will not come. You
Right.
understand? It's
Right.
even there for the educated lot. It's not just for the uneducated, but also for the educated people. They take a lot of time to go to the right person. They'll keep roaming about of what other people are telling, and that's where they're making a mistake. And that's where we at such forums have to come together, to discuss this openly so that people don't feel ashamed of it. There's nothing to be ashamed of it. And let me tell you, all the infertility issues which happen around us, only maybe 5 to 8% will be there which cannot be cured, or where you cannot have a baby. All 95% of you will still have a baby.
Right. So this is like a big issue out, at least here in India. People don't want to talk and they just accept this as a taboo, and they keep doing other stuff, but they don't want to go to a person who's going to guide them right.
Yes.
So to begin with, let our audience know exactly what infertility is and what causes infertility.
So see, when we talk about infertility, as per a definition, it's defined as, a year of unprotected intercourse. So when you've thought of planning to have, and you're not using any contraceptives, and within 12 months you could not conceive, that's actually termed as infertility. But in some few cases, infertility can also happen like earlier, especially if you're married after the age of 35. Now, let's not say that you have to wait for a year. Maybe after, within 6 months, you would like to go to an infertility specialist. Also, cases where you know you have some issues, especially like PCOS, or if you have a fibroid uterus, or if you have irregular cycles. That also is the case where you're not. And when we talk about causes, there are lots of causes for infertility, and we've been discussing a lot of them everywhere. The important causes.
Niharika, we can't hear you. This,
Can you hear me now?
yeah, now it's better. Now it's better.
Yeah. So as I was saying, there are a lot of causes for infertility, and we divide them according to male, female, and unexplained. So when we talk about the causes of infertility, it's so easy to actually identify the cause in at least 80% of the couples. So first important thing, when you are diagnosed or when you want to plan a baby and you are not being able to, it's important for you to go to an infertility specialist as a couple and not just alone, because
Right.
male causes can be easily diagnosed. One semen analysis done at a good lab will actually keep the male aside, so we know that the male is okay that time. Very
Right.
rarely the male has to be go through other investigations. So it's so important. Most of the females which come to us will come alone, and the husband will not come, and that's something which has to be taken into picture. Other important causes can be like ovulatory causes, where the woman is not ovulating properly. That means you have a normal menstrual cycle of 28 to 30 days, where from your second day of period, slowly a follicle starts developing, and then around 12th or 14th day this follicle ruptures and the egg is released. This egg travels into your fallopian tube, where it meets the sperm. That's called normal ovulation, and then the normal reproduction happens. Sometimes, in cases like polycystic ovaries, this ovulation does not happen as according to the timeline which is there.
Right.
And that's when you have some ovulatory disorders. The other important thing here is the tubal block. Your fallopian tube will be blocked so that the sperm or the egg cannot meet. Third important factor can be the uterine factors. So now the sperm and the egg met in the fallopian tube, they'll travel back into the uterus and get stuck there. And that's where your baby grows. So if your uterus is abnormal, or if your endometrium lining is not adequately thick, this implantation will not happen. And that's where the uterine factors come in. So it's like a cycle which has to follow specific timeline.
Right. So that was a real good information, but still I have one question, Niharika. So these are all in the medical terms. Like a normal couple, how can a couple understand that they are not conceiving naturally or they are facing infertility issues and it's a time to go for a professional help or a guidance?
Yeah, so see, if you are a couple, you've been married for at the age below 35 years old, and you've been trying for 1 year. So that means that for these 12 months, you've not been using any contraception and you're doing regular intercourse. And then you do not conceive. So that's the first step.
Okay.
Second is, if you're more than 35, then you have to take this timeline into half. So you have to go to the doctor within 6 months. Third is, if you know that you have some issue in your body, like irregular menstrual cycles, especially, or if you have, especially for the males, if they have some problem in ejaculation, then they would like to go a little earlier.
Okay. Okay. So, as we all see, earlier there was not much of these complaints or the issues coming up. So, what exactly has made this rampage in this infertility cases? What is
No,
the difference between a decade back and now? What is the major difference?
so even if I ask you or if I ask myself, when we look back, our parents had their kids when they were in early 20s.
Yes.
Okay. I had my child when I was in my early 30s. So,
Right.
uh, as the women are getting empowered, I think it's not a bad thing, it's a good thing. But somewhere the woman has to balance that life with her career, with her reproduction, because it's in her hands.
Right.
It's very easy for the men. Their sperm count doesn't get affected till almost the age of 40-45, but the woman's egg quality drastically decreases after the age of 35. So whenever somebody comes to me, I know we want to study. I am also a doctor. I have also studied for almost 15 years. But we have to understand that balance. And I would always tell them that you have to complete your family before the age of 35.
Right.
After the age of 35 is when the problem starts happening. And that's what is happening now, because most of us want to get pregnant once we're settled down in our life.
Yes. Yes. So earlier there were marriages were like at 16, 17, or maybe 20,
Yes.
25. Now that thing has only shifted to 32.
Yes,
Yes,
true.
of course, of course. So, as per you, do you think our lifestyle, our food style, and all these things also affect our fertility?
ओ यस अ लॉट ऑफ इट जब हम पुराने जमाने की बात करें वी डिड नॉट हैव सो मच ऑफ प्लास्टिक बॉटल्स वी डिड नॉट हैव पैक्ड
Right,
फूड्स घर
right.
से एक स्टील का डब्बा आता था स्टील की एक बॉटल आती थी यू अंडरस्टैंड ऑल दिस नाउ वी
Yes,
हैव ऑल
yes.
दिस packed food like those cheese slices, those chips and biscuits. Somewhere that processed food is affecting our fertility.
Okay.
Second thing which is affecting is that lifestyle change which has come from drinking alcohol, smoking, even that hookah culture which is coming up so much. If you see, go to all those restaurants, most of them will have a hookah, and most of the
Right,
females will be also doing it. So
right,
these things affect men and women equally. So lifestyle is really important. Third important thing is all those pesticides and herbicides which are used in plants which we are eating right now.
right.
All these things are known as endocrine disruptors,
Okay.
and that's also a reason, if you see, that cancer is also increased. If you know
Yes.
now, I know one cancer person in every house, which is a huge thing.
Huge number, right.
So these are endocrine disruptors, including the pollution around us. And somewhere we all have to now take that step back and we have to truly work for our environment. It's really affecting us head to toe.
Right. So now, when we all know what is the problem, what is the causes around, so can you help all the women or the men who are watching us, can you help us with the infertility solutions? So can you guide them with the options that exactly how can we solve this problem?
So it's not very difficult. Most of the infertile couples will just need a counseling.
Okay.
Some of them will not understand when they actually have to have the intercourse, when the ovulation actually happens. So that's why when I tell them that they have to come and talk to an infertility specialist. So if 10 infertile couples come to me, two will conceive with just counseling and explaining them what is timed intercourse.
Okay.
So you understand? One or two will only conceive with some lifestyle changes. Like if they are really obese, they start following a good exercise pattern. If the husband is smoking or having too much of alcohol, that change, only one or two small changes also will affect and improve their fertility.
Okay.
So out of those 10, 6 might need a little more evaluation. So that
So there are a lot of
evaluation happens.
yes, yes.
So that evaluation actually happens is the first test I always do is a semen analysis, because we know then that part is clear. And the second test which we commonly do is a tubal test, which tells us that your tubes are open or not. And I do an ultrasound on whenever you come to me, which will tell me whether you're ovulating and you have ovaries with follicles or not, and your endometrial lining is okay. So
Okay.
once all these are clear, so now I know if you have nothing else, you are okay with all these are very baseline tests. Then I give you another 6 months with only some lifestyle changes. So the next option is when you have some problems with the semen analysis, like you have borderline oligospermia, which is decreased count, or you have poor motility in the sperms. Then the second step comes, which is known as IUI. It is known as intrauterine insemination. So
Okay.
here what we do is we give the female some drugs to make her follicle grow, and we prepare the sperms, we wash them and we prepare them so that they are a concentrate, and that concentrate is taken in a tube and inserted into the uterus at the time of ovulation. So this helps, like in a layman language, if you're going from Agra to Delhi, you would like to take the highway instead of taking the old road. So
Right.
the distance which the sperms have to travel becomes half, is what I tell them. So
Okay.
that's where the second thing comes. Also, this helps in polycystic ovarian syndrome because polycystic ovary patients have poor ovulation or slow ovulation. In this way, we can time their ovulation. So they also conceive easily if done well.
Okay.
Now, third thing which we say is when I was talking about were uterine factors. So uterine factors can be when your endometrial lining is not growing well. So the endometrial lining is the lining which sheds off during your periods, the blood which comes out.
Right.
Or if you have any abnormality in your uterus like fibroid uterus or adenomyosis. So if you have all these things, then an infertility specialist will shift you towards laparoscopy and hysteroscopy. So
Okay.
these are methods where a camera is put inside your abdomen and inside your uterus to rule out those causes. The last stage which comes is IVF or ICSI. So it's not the first stage. That's why people get scared to come to us because they think कि सबका IVF होगा. But सबका नहीं होगा. Out of
Right.
those 10, only 1 or 2 will need IVF.
So there are a lot of questions around IVF which keep coming. So is
Yeah.
IVF and IUI is a painful procedure?
No, it's not painful if you are not scared of injections. So in
Okay.
IVF you will get a few injections like for about 9 to 10 days. The procedure as such is not painful because when we retrieve the eggs or when we take out the eggs, we give you mild anesthesia. And once the embryo is done, it is just inserted with a very thin tube in your uterus, and that's not at all painful. The pain is only with the injection. That's it.
Okay. So is there any side effect with the IUI and IVF?
So the see not for long. See, these cycles have to be limited. So when we're talking about an IUI cycle, I would not like to do an IUI cycle for more than 4 times. So
Okay.
if you've not conceived with an IUI in 4 cycles, then we shift towards another step. We cannot keep continuously giving them for 1 year, 2 years. So that's where you have to limit yourself. The common side effect, which I'll say it's not even a side effect, but it is something which should is of concern, is multiple pregnancies. So when we give you drugs to induce ovulation, a lot of follicles grow, and sometimes you can get twins and triplets, and which is something like a side effect because we as infertility specialists do not want that. Because twins and triplets means your pregnancy will be a little more complicated than the rest,
Right. Right.
but no major side effect. Very, very small risk. A very small study was done which said that these drugs can maybe cause cancer, but that also was ruled out. So, right now, as such, we don't have any major side effects if
Okay.
done well.
Right. So if any of the couples want to go for IUI or maybe IVF, so is there any precaution that they should be taking or maybe 3 months before? How
So,
they can prepare themselves?
anytime you plan a pregnancy, we always say that you have to meet a doctor 3 months prior. Because the
Right.
first important thing is the doctor will take your complete history, and they'll check you for any problems, any medical diseases like diabetes, hypertension, thyroid in your body. Then
Right.
they would also like to start a folic acid supplement. A folic acid supplement is very important to prevent birth defects in your child.
Okay.
The next step here is, if I would like to see you 3 months before, because then I would give you a lifestyle change. So I
Okay.
would want you to decrease your smoking, alcohol, start exercising, follow a proper routine, like maybe sleep wake cycle has to be proper, because once your sleep wake cycle is proper, your body's hormones also start following that. Most of the couples right now sleep at 1 o'clock, 2 o'clock, very late. And then their cycles are very hampered and they don't understand it's playing an effect on their body also. So
Right.
your sleep wake cycle has to be regularized. And if you are overweight, you start reducing weight before planning your cycle.
Okay. So once the treatments are done, till when pregnancy can be confirmed? Is there
You know,
any?
so so if I do an IUI, I would tell you to get a urine pregnancy test done after 18 days. And it can be as early as after 15 days. We can also confirm from a blood test, which is known as a beta HCG levels.
Okay.
So if it has worked, it will. You can see 2 lines on the kit after 18 days.
Okay. So you have explained things very well, but still there is one confusion that is there in me. What if the cycle of infertility treatment doesn't work? So should a mom try again? And if yes, when?
Yes, of course. See, nothing is 100%. You have to
Right.
understand when we are doing IVF also, if we consider IVF as the last step, I
Mm-hmm.
know that the egg is okay. I know the sperm is okay. I know the embryo which was prepared in the lab was okay. But
Right.
when I insert that embryo in the cavity, I do not know that that cavity is accepting that embryo or not. And that's
Okay.
where most of the cycles fail.
Okay.
So your first cycle is like a investigating cycle for us also to understand your body.
Okay.
So out of the 10 people who are doing IVF, maybe 4 or 5 will conceive in the first cycle. Out of those 10, 5 conceived, 5 left. Out of those 5, maybe 2 or 3 will conceive in the second cycle. The rest, maybe 2 or 3 will need 3 or 4 cycles if they have some other issues. So you can go up to, if you read the theories, then maybe 8 to 9 cycles of IVF, but that's not actually needed. Most of them conceive within the third cycle.
Okay. So hope all the information that was shared by Dr. Niharika is really helpful for everyone who has joined and listening to us. Please share all your questions in the comment box. We'll be happy to take the questions. Well, as we all know, the Taj Mahal was not built in a day. So the miracles also take time to happen. And with positive thoughts, right guidance, any goal can be achieved. Moving ahead with the evening, there are a lot of questions, myths, taboos, which every woman who goes through infertility or late conceivings, especially in our culture and with the society pressure, I did a lot of research actually before coming to you for this topic, and I came across thousands of myths and taboos around this, and I really wanted to break them with you, Niharika. So there are
Yeah.
few of them. Let us just know whether we should believe and how much we should believe, or maybe we should just let them go. Okay, so the first one, despite women being the general target of pregnancy, it is always considered that the infertility is always a women's issue.
That's so like, whenever people tell me this, I get so angry.
Yes,
Especially, women come with their family, they'll not come with their husband. And
they
then
don't
the
want
family
to
is
get
blaming the
testing done.
woman.
Yes,
Yeah, it's crazy. 50% of the child is yours, the husband's. So of course the 50% of the infertility issues will be all yours. So you also better get tested.
yes, I can completely relate to this because this is something very common around, and we listen and we don't
Yes.
want to accept this thing. It's always come on
Not
a
at all.
woman's
And
head.
men will vanish after one sperm semen test done. And if it's not okay, they will
Okay.
not come back for a very long time. It's very hard for them to accept it. But on this platform, I would like to say we have treatment for everything. So it's a
Right,
simple treatment and they should actually follow up with their doctors.
right. So moving on to the second one, it is again for the women. Age only affects women's fertility and not men.
You know, uh, I would say that's a little bit true. Our
Okay.
eggs will decline, our ovarian reserve will decline once we
Okay.
cross the age of 35. But
Okay.
men's sperm count and sperms can actually go up to 40 to 45. And then they start getting a little affected. So, yes, women will actually get their fertility decrease the ratio curve will fall a little earlier than men. But
Okay.
it's not that they will not have issues. They'll also start having issues, but a little later.
Okay. Okay. So moving on to the next one, it is if you already have a child, you don't have to worry about infertility.
No, that's not true. So there's something known as secondary infertility. So when I was telling you that 1 year of unprotected intercourse is infertility, yes, primary infertility. That means you've not had any issue before. But there are some places where after a child or after an abortion, you do not conceive. And
Right.
that's when it's called as secondary infertility. And those causes are different. And those causes are mostly related to your endometrium and any infection which has happened during the course. So yes, there is also something known as secondary infertility. So even after one child, you will need help of an infertility specialist.
So, you have been in this field from so long. I'm sure this is a myth, but still I'll ask you. Every fertility journey looks same.
Oh, not at all. Not even your journey. If you're doing 2 cycles on the
Right.
same patient, they are completely different.
Okay.
You cannot predict how the body will react to what. So, or even cycle to cycle variation is drastic.
Okay.
Yeah.
So, have you came across any such incidents which you want to share with us that making a mother, a woman understand, or
You
any
know,
such experience of your life?
so no, I have a lot of experiences now. I've been practicing for more than 15 years.
Yeah.
But yes, there is one experience which I would like to tell you. She's very close to me. She's also on Instagram. She is the only patient where I thought I could not help her. So we did around 5 IVF cycles with her, 5. And she could not conceive. And she was so allergic to the progesterone supplements which we give that whenever we used to, and those supplements are very important. Progesterone is like the mainstay for your treatment. So whenever we would give her progesterone after her IVF cycle, her nose would flare up like a big potato, like huge. And after the fifth cycle, I told her that maybe you should go to another doctor. Maybe you will have some luck somewhere because it's not working. And she still stuck to us and she got twin daughters in her sixth cycle. So that was my longest case. She was with us for almost 1 year for her IVF and then 1 year throughout her pregnancy. So now her daughters are 2 years old, and that is some one patient which sometimes that trust
Right.
also is very very important. She
Yes.
kept telling me that I'll get a baby from you, and that actually happened. So
So
there
that
are
is
things,
the,
miracles which can happen.
of course, miracle always happens around us. So the trust, your positive thought, it always
Yes.
makes a difference in your life. So this was a really informative session, Niharika. I have to good. I pushed you for this session. I'm sure a lot of women out there and the men also who are listening to us today, they all must have got a lot of things to know, and they
Yeah.
must, if they are facing this issue, they will understand that they have to go to an expert.
Yes.
Achieving anything in life without any hassle is no doubt the best feeling. But for some of us, not everything comes easy. But as it is said, even miracle takes time to happen. So stay positive and go for help and right guidance. Thank you so much, Dr. Niharika, for your time and your guidance today. It was really nice having you on my platform and talking about such a sensitive and important topic.
Thank you so much, Nisha, and thank you to everyone who's here.
Yes,
And
you'll
I
see a
hope we
lot of
keep
people out
continuing
there.
these sessions, and we're
Yes.
going to maybe remove this taboo from India.
Thank you so much for
Yes.
that. It will be like a big blessing for everyone. Thank you so much, mommies, for joining us today. Please do not forget to share your feedback or if you have any question or any particular topic which you want us to bring up. See you soon. Have a nice evening. Thank you so much.
Thank you, everyone. Bye bye. Stay
Bye,
safe.
Niharika.